Hi, this is Dr. Levine and welcome to my YouTube channel. If you're looking at this video, that means that you're about to undergo a reverse total shoulder replacement. So let's start with the basics. Your diagnosis is usually that you have something called rotator cuff tear arthropathy. That means you have a massive irreparable rotator cuff tear and you have bad arthritis. You may also have really bad arthritis and significant bone erosion on the socket, such that an anatomic replacement would not be possible. Or you can have really bad arthritis and a rotator cuff that just isn't functioning very well, but might not be torn. Those would be the reasons that you're going to have the reverse replacement. So people always ask, well, what is a reverse replacement? This is what it looks like. This is a scapular model, and you can see in the model is this metal ball. There are screws that are holding it in place while it heals. And then on the humeral side, you can see this acrylic humerus. The stem goes down the middle of the bone, and there's a plastic liner that goes on top of this tray, such that it will fit like this, and then allow the deltoid muscle to move the shoulder. So that's what a reverse replacement looks like. What's going to happen on the day of surgery is that you'll come to the operating room. You're going to get a regional anesthetic block, which means we'll put your shoulder to sleep, but you don't have to have general anesthesia. It's sometimes called twilight anesthesia. They'll make you drowsy, similar to when you get a colonoscopy if you've had one in your life. The operation is the shortest part of the whole day. It takes about an hour and 20 minutes, give or take. You'll be placed in a sling after the operation, and you only wear this sling for 2 weeks following the procedure. You come out of the sling the day after surgery to move your elbow, wrist, and fingers, and we'll refer you to our other video that shows the specifics on that. We will then see you for your first post-op visit 2 weeks after the surgery. At that visit, we'll make sure everything looks good and the wound is healing. We'll get some x-rays to make sure that everything looks good. We'll discontinue use of the sling after that visit, and then we will begin formal physical therapy. You can also begin driving after that 2-week post-op visit if you feel safe and comfortable. If you don't, you'll wait till you do. Our goals for the first 3 months from the operation, what we call phase 1, are for you to regain your range of motion and flexibility while the soft tissues around the shoulder heal from the operation. Phase 2 begins from month 3 through month 6, and that's where we work on strength and functional recovery. I will see you in the office for your second post-operative visit at the 4-month post-op check. At that time, we'll get x-rays again to make sure everything looks good. We should see you having pretty close to full range of motion and already have done about a month of strengthening, as we said. Your third visit will be 1 year post-operatively. Again, we will get x-rays, make sure everything looks good. And your last visit with me will be at the 2-year post-op check, where we once again will get x-rays, make sure everything looks good and that you're doing well. If you have problems before that time or in between those times, obviously you'll call the office and we're happy to see you at any point. So again, your diagnosis is likely rotator cuff tear arthropathy or arthritis. That means a massive rotator cuff tear. We can't fix it. We're going to do a reverse shoulder replacement. We've gone over what that looks like and what your expected post-operative course will be. If you have any other questions, you'll let my staff or my team know. And thanks again. This is Dr. Levine. We look forward to taking care of your problems and taking away all of your pain in your shoulder. Have a great day.